I've probably been on the foundation board, I would say 9-10 years.
I've been previously involved with the hospital. I had chaired the board years ago, and most recently I just became a member of the finance committee.
St. Pete's was always just our local hospital, and they were always there for us. And so we've always been involved with the hospital, with the dialysis unit, with the cancer treatment center.
Pam is a 3-time cancer survivor. We're healthy because of the care we received from St. Peter's Health. There's no question about that. The Hospital Foundation provides a great need here in the Helena community. They do a lot for education, for employees. They do a lot for providing funds for people who can't afford health care, and they help to supply those funds. A strong hospital foundation provides the resources back to the hospital and back to the community so that we all become stronger as a result of what the Hospital Foundation does.
I love being on the foundation board. I love being a part of St. Pete's, and I think I kind of have a unique perspective in that I've been a patient for so many years. I kind of have an understanding of how things work. The different things that I've been through helps me understand how important it is for people to donate and be a part of the community.
Montana has the highest suicide rate in the nation.
Mental illness in our community and in our state, as we all know, is at the bottom of the barrel.
Behavioral health is such a crisis, and so one of the pillars to the campaign is to invest in that mental health, behavioral health side to provide those services that are so needed to people in the Helena area.
I hope that Helena can maybe become a leader in our state for mental health issues. That's kind of what I envision. The mental health crisis is just so big in our state.
The second component has to deal with childcare. Right now, St. Pete's has a facility that can handle just over 40 children. This money that will be raised will be used to expand it to over 200 children. And if you look today at the expenses of a household, the second highest expense that a household has is childcare. So if we can provide those services to employees, it will help us attract and retain a quality workforce. That's a big benefit that we can receive here in Helena. We have an endowment fund for employee scholarships so they can continue their education, which is really critical and important to maintaining and keeping your workforce. The third component has to do with improving the quality and delivery of healthcare. What can we do from a foundation perspective to invest back in the community? And the last piece has to deal with community services. We're seeing more and more demand to deliver healthcare services in people's homes. It's so much better if we could get the people in their homes for some of that delivery, and we're seeing an increasing trend in the country for that. We need help from the community. There are people out there who can help us, and what we're hoping with this video to do is to educate people on the importance of this campaign, because lots of people are asking for money for lots of reasons. And so St. Pete's is in the game for this capital campaign. And I want people to understand from a patient's perspective and from our family perspective, the importance of donating, because this is important not just to our family, but to everyone's family in the Helena area.